The private-public model for cataract surgeries in Ontario is not working, at least not how it was supposed to. The province started moving the operations to private clinics to reduce wait times in hospitals during the pandemic. But now, new research is showing that private cataract surgeries are delivering nearly 90,000 fewer operations than expected. And it comes except for when it comes to the patients who have the highest earnings. So joining us with a look this morning about the concern and who's being left out is optometrist and lead author of this study, Dr. Robert Campbell. Great to have you here.
Good morning. Thanks for having me.
So how much has the growing privatization of cataract surgery affected lower-income Ontarians? And it's important to note here, low income also refers to those on fixed incomes, like seniors who are in the category of those in high need of these operations.
Yeah, that's a great question. You know, certainly seniors are by far the most affected by this. Cataract is definitely an age-related phenomenon, and the vast majority of our patients are in the older age groups, and as such are quite vulnerable and influenced by the care system and depend on our care system. You know, as a way of background, cataract surgery is by far the most common operation done in Canada and has an incredible impact on people's quality of life. So it's really important everybody has really great access to this. But unfortunately, you know, in Ontario, we've seen a move towards funding surgery in private centres, as you mentioned, and up to about a quarter of cases are now being done in private centres. And the infusion of public taxpayer money into these centres was actually designed, you know, in theory to influence care and improve care for everybody, regardless of ability to pay. But what we've seen is a vast majority of cases being done in private centres are being done for the wealthiest in our population.
Yeah, and a lot of that comes down to what you're willing to pay. I know this because my parents just went through this. It's either wait 6 months to get your cataract surgery or pay triple the amount and have it done by Thanksgiving. So a lot of Ontarians are in this same position. You either have a longer wait time or you pay a lot more money and you get it done immediately. What is the solution here?
Right. So, yeah, that's, you know, not how our system is supposed to work in theory, right? We really shouldn't be having the ability to pay one's way around the wait list. We're a publicly funded Medicare system. So how is this happening? And clearly, you know, we don't have all the answers. But as you said, there are extra payments that are driving people, you know, out of the private system and into the public system, or vice versa. We think the solutions, you know, some would advocate that really Medicare-based, you know, medically necessary surgery should be done in hospitals or not-for-profit, you know, centers that are outside of hospitals. But if we're going to continue down the private system, then a couple things that I think could go a long ways to helping us would be wait time management. So let's regionalize wait lists so that there really is no way to jump the line, regardless of where your surgery occurs. It'll be, you know, done in a fair way. And the other thing is all medical and surgical decisions should be based on the patient and the patient alone. So we really need to get the profit incentive out of there. And one way to do that is to deal with conflicts of interest so that the centers and the surgeons are paid well, but paid fairly and equally, regardless of how they do the surgery.
Cataract surgeries, you know, you've mentioned this, are the most common procedure for ophthalmologists to perform. So then how does the privatization impact public healthcare workers and the system overall? With a reminder that the idea was you do the surgery in a private clinic, but you don't charge people for a private surgery, if that makes sense.
Right. And that was the goal. You know, we heard that people wouldn't be paying out of their pocket for their surgery. This was strictly going to be the government funding the surgery in private centers. But clearly we're seeing that because of extra costs, that's not how it's playing out in the real world. As you mentioned, there are other impacts, you know, even within our public system. So within the not-for-profit realm, we have a limited number of nurses. So if they're working in private centers, they're not working in hospitals. So the damage goes beyond just access for lower income Canadians. It may have, you know, downstream ripple effects as well.
Dr. Campbell, while I have you here, a really quick question. One of the things that came up when my parents were making this decision is that the lenses at the private clinic are better than the ones that are being offered by the province. Is that true?
That's a controversial thing to say. There are lenses that offer different features, and whether that makes them better or not is debatable. There's some that may give one both distance and near vision, but there are compromises and complications that arise from that. So there are times where you know, the lenses are more expensive. The companies that make them charge more. And to be honest, in hospitals, there may be charges, but the idea is that those charges should be kind of a cost recovery. This is what it cost, so the patient can cover that cost, but there shouldn't be a large, you know, profit margin built into that and kind of hidden within that.
Thank you. It was one of the things that came up when this issue was brought up. So I appreciate you clearing that up. Dr. Campbell, thanks for coming on today.
Thank you for your time.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.